Good morning. This is Dr. Renee, and I'm here doing Facebook Live with Black Doctor as usual. This morning we're going to talk about coronavirus. We are blessed to have an infectious disease doctor right here in Chicago come and speak with us today, Dr. Toyin Falusi. And thank you for coming.
Thank you for having me, Dr. Renee.
And so today we are going to dispel all the rumors and get factual information out there. Also let you know where to find factual information besides here at blackdoctor.org, but to make sure you're not reading any of these fake sites and you're finding out the actual information of what needs to happen so that we can eliminate what's happened in other countries happening in the U.S. So, first thing we need to know, can you explain what is coronavirus? Because I have received umpteen text messages with pictures of coronavirus is one of the things that the Lysol takes care of. And so people are like, this isn't new. And so can you explain, because we learned about coronavirus in medical school. We heard of it before. We knew exactly what it causes, but this is something different and people need to understand what this actually means.
Okay, so coronavirus is a host of part of a body of viruses that are RNA viruses. So viruses are very tiny, you can't see them. They're smaller than bacteria, smaller than fungi, and they cause infection. So coronaviruses have been around forever, and it's a very common cause of the common cold that people get. However, this new coronavirus is one that is sometimes called coronavirus 2 or SARS-CoV-2, similar to this, the SARS virus that we remember from 2003, the outbreak. So it is SARS-CoV-2, and in 2019, eventually the WHO just decided, let's call this coronavirus 2019, just because it was a new strain of a coronavirus, one that seems to have originated in animals and infecting humans, and for the first time. And so because we don't have immunity to this new virus, it's called coronavirus 2019. So it is a family of coronaviruses, but it is a new strain, and we don't have natural immunity to it because it's new to humans. And initially, when the outbreak in China started in December, it was called the Wuhan Virus, and everybody said the Corona Wuhan Virus. And very quickly it became something that was happening in China and China only. But from the public health impact, we know that this will eventually move to other parts of the world. And so to avoid all of that and to say this is a coronavirus, we know about it, we've sequenced the genome, it was named by the WHO coronavirus 2019 or COVID-19. And sometimes it's referred to as SARS-CoV-2 because it's similar to the SARS virus that caused the syndrome and the SARS outbreak in 2002, 2003 that some of us remember. And so yes, it is a coronavirus, but it's a different strain, and it's infecting humans for the first time in the last couple of months now. And so it's COVID-19, and that's what it is.
So what can we, as just regular human beings, everybody, what can we do to prevent this from spreading?
Okay. The biggest thing is, first of all, taking a deep breath and not panic. And that's hard sometimes because there's a deluge of information. There's
it's just too much. Maybe you need to turn off your device.
So there's actually some stuff about having helping people cope with the anxiety and information overload. It's natural to feel panic. Even people in healthcare are like, what is this? But the panic is not the right answer. It's being able to figure out where your information is coming from and going to a credible source of information. CDC.gov is a great site, WHO. There's a lot of information out there, but if you want to get credible information, it's very easily broken out on the CDC website for healthcare workers, for the community, for people taking care of patients, things like that, so you can find that. But the main thing that we can do is personal hygiene in terms of hand washing, keeping our surfaces clean, and also social distancing. So thinking about this prevention as for ourselves, but also for the people that we know and care about, and for the people that we don't know or care about who might be exposed to somebody who we know and care about. So again, when we try to explain it, it's like the personal good and also like the good of all of us, greater good of all of us. So the simplest thing, and sometimes it seems less, it doesn't seem very, I'm trying to find the word, exciting. When people say, what can I do? I say hand washing, personal hygiene, they're like, that's it? ID doc, that's what you got? That's what you got, because this is about prevention, right? So we know that most people who get this virus, more than 85 to 90%, will have a mild illness and do well. But there is a subset of people who are not going to do that well with this virus. There have been deaths from this virus. But again, the goal is to prevent, right? To prevent, and the prevention is hand washing with soap and water
Yes.
for at least 20 seconds.
So you need to, don't count 20 seconds, say the ABCs. That's going to give you 20 seconds or more. You can sing happy birthday, the good old regular happy birthday twice. I love Stevie too, but the good regular happy birthday twice. I've heard the Outcast, the chorus of Miss Jackson. Whatever you need to do, sing for 20 seconds. Set your phone, tell Siri to tell you to time it, tell Alexa, tell your Google Home, whatever, to time. Make sure you wash for 20 seconds. 20 seconds or more to make sure, and it's soap and water. Just good old regular soap and water. Antibacterial soap is great, but soap and water. And then, if you notice, most buildings now, it's not even just in hospitals, you will see sanitizer. Everywhere. The best thing to do, in my building, as soon as you get off the elevator, there's sanitizer. Sanitize as soon as you get off the elevator before you go outside. When you come back in the building, after you touch those doors, you sanitize again. If you use cabs, Ubers, Lyft, most of them are trying to carry sanitizer as well. When you get in, you should probably sanitize, and before you get out. Now is a great time to carry around a little bottle of sanitizer in your purse, in your bag, in your pocket, because you want to sanitize after you've touched car doors and after you've opened doors into buildings. Because let's face it, a lot of people cannot just sit still. There are things they have to do, and they have to keep living. And so, and actually the economy needs a lot of us to keep on going, because we're going to have a huge hit from this. But you want to make sure that you at least protect yourself, because you making sure that you're healthy is helping all the people around you that you come in contact with, people you know and people you don't know. So I know that we are really, besides stressing the hand washing and the hand sanitizer, we really need to look at a certain population.
Correct. And just before we get into the older population and people who are at risk with comorbidities, is that exactly what you said, that the things we're doing, because we say, how does hand washing have to do with the virus that causes pneumonia? It's because we're always touching. The virus has to it's not going to go through your skin. It's not going to break through skin. It's going to go in through mucous membrane.
So
either
it's respiratory droplets.
Correct.
So it's coughing or sneezing. So if we wash and wash.
Correct. Coughing or sneezing on your face, or people are coughing and sneezing, and then touching handles and touching stuff. So what you can control is how you do stuff. So if you know that you're ill, staying away from public places, calling the emergency room or your doctor before you go in, so you're not exposing people in the waiting room. And what you can control is other people's personal hygiene. So not assuming that the person who touched the door before you didn't just cough in their hands and touch the door. If you assume that they did, then you are more likely to clean and things like that. And then just calling out, this is one time people are calling out bad behavior. If you see somebody coughing into their hands, you need to tell them, we need to. See something, say something. This is one time where it's really important. If you see people, there are actually videos now showing adults how to cough into their elbows, and so, because you see people who do that, and then they don't reach out, don't do that.
The handkerchief is all lovely, but now
it's not a good idea. You're supposed to use tissues.
If you use a tissue,
throw it away and wash your hands. Sanitize right away. So
and those people walking around with the disposable masks that are just they're disposable. They are not to be used over and over. Honestly, you are spreading and not helping.
Correct.
So, and why are you doing that? Because one, anything respiratory droplet is going to stick to this mask, and now you're fidgeting with the mask, and we just told you don't touch your face. So you're fidgeting with the mask. I was walking on Michigan Avenue on Wednesday, and I was so glad. I only saw 2 people that had these disposable masks on, just 2, thank goodness. But for all the people I saw, I was very impressed that a lot of people knew. Don't do that. One, like I said, it's going to probably spread, not help. 2, there is such a shortage of masks for the people that actually need them, like her. And people who are in hospitals who have to work with patients every day, they need the protection. You don't need it. And so you need to, and they are in a closed environment, so they know how to properly use them. You need to let them use it. I'm sure you saw this, I think you're in one of the groups I'm in, but one of the groups I'm in, one of the physicians said that her hospital, this was 2 weeks ago I think, said 1 mask a day. She's an anesthesiologist. That's disgusting. Can you imagine? Because if something gets up on her mask, but they said one mask a day.
There's such a shortage.
But there's such a huge shortage, and this is why I'm saying, please let the right people get them. Exactly.
And that's the other part. Somebody actually put a meme up, like, if you hoard all the supplies and everything and into your home, for us to get rid of this virus in the community, other people have to be able to wash their hands too. Like, it's like
right.
you emerge and everybody else, you're not. And so, the only time is if you are ill, if you are coughing, you're sneezing, and you're on your way to the health, your doctor said, meet me at 10 a.m., you're coming in through the side door, we're going to test you. You need a mask. If you're on a plane, for some reason you start coughing, they will mask you, because what you want for somebody who's coughing, you want to make sure they're not their droplets and spreading. Right. But for the average person who has no symptoms,
and you need to wear a mask, don't leave the house.
Correct.
Just stay home.
Correct. Call ahead.
Call the doctor,
and they'll let you know.
One, if you need to come in, because there's a whole lot of telemedicine going on.
Oh, yes.
And that you don't necessarily need to come in. Perhaps they're going to call you in a prescription.
And they'll triage
and
you.
then, they'll triage you, call you in your prescription, and someone else can go pick it up. Or nowadays, these things can be delivered. Yeah. And so you don't need to leave the home. So if you are wearing a mask, I'm assuming you're sick, and you should probably not be out.
Correct. You should not be, unless you're seeking medical attention. Obviously, if you're having shortness of breath and high fevers, people have to go to the emergency, because there is a subset who are going to be very sick from it. But other than that, the recommendation is not to walk into the ER, because the chances of COVID versus a regular cold or flu are much lower, right? So going in there, you may pick up something else you didn't go in with, but also it's not a good way to utilize the resources and all that. Is call in, call ahead. They'll triage you. A lot of telemedicine now that's going on to figure out what's going on. If you do need to come in, they can arrange how you can come in. They know you're coming in at 10 o'clock, get you in, do the testing, get you back home.
Right.
If you don't need to be hospitalized. And that way you're not exposing a lot of people if you potentially have this virus. So it's really important. I'm glad you brought up the mask issue, calling out bad behavior when we see it, and assuming that everyone's personal hygiene isn't as good as yours. So when you've touched surfaces, shared surfaces, things we don't think about, and we touch our face anywhere from 80 to 100 times a day, the average person, some of us more. So that's why it's important to know that shared surfaces, even our phones, there's now ways about cleaning your phone.
Yeah, I
clean everything, because then you do all this stuff, you put it out there. So it's really just about that. And then social distancing to make sure that large gatherings and places where you're not able to maintain at least 6 feet from the next person, it's hard to do that and not transmit the virus. So that's really important.
So they're saying 250 or above. They're saying 250 or above is probably too many people. Mm-hmm. So therefore, you probably should avoid that. I think a lot of things have been canceled that are large.
Yes.
Or large.
Medium.
Large galas, concerts. Tournaments, Broadway, everything. So a lot of that stuff has been canceled already. But if it hasn't been canceled, then maybe you should think about, do you really need to go?
Correct.
And so I personally, I'm not in the age range that probably needs to be concerned. But if you know that you are going to come in contact with somebody who is over 60, then you probably should think twice about going to that function. Now, can you give the numbers on the deaths of the people that are 60 and over?
Yeah, so there's ways, because now we've had about almost 5,000 deaths, about 5,000 deaths worldwide, not in the US, worldwide. And what we know very clearly from the very earliest, even when it was just in China, was that people over the age of 70 and 80 had the highest mortality or death rate. And now we know, with all the data from about 5,000 deaths, that it seems like the point is at 60 and older is when we start to see. So before 60, the mortality rate or death rate is less than 1%, much lower than that, 0.1%. That's like 1 in 1,000, once you hit 60, then it starts going to about 3%, right? Which is 3 out of every 100. That's a lot. And then when you go from 70 and older, from 70 to 79, because the data is looked at by decade, 70 to 79, it's about, it goes up to about 8%. That's 8 out of every 100. And when you go to the 80 and above, it can be as high as 14%. That's really high. In some countries, higher than that. So that's why 60, because 60 is not old, right?
It's not. No, it's
but
not.
So there's age, and then there's comorbidities. People who have diabetes, heart disease, lung disease, COPD, asthma, people who have underlying diseases. immunodeficiencies, because just like in any other thing, they're not able to fight the virus.
HIV.
And because this virus goes directly, the main organ is the lungs. People die of a pneumonia, they need a ventilator.
So
if you already have lung problems, you don't have the reserve. Smokers seem to have a worse outcome. Makes sense.
For obvious reasons.
Because you're not able to clear out things like that. You always have lung damage. So there was ever a time to not start smoking and to quit. This is the time. So smokers have a worse outcome because there's already damage to the lung lining, the things that allow us to help clear things that get down the wrong way. So, older than 60 is where that mortality goes up very fast. And also if you have underlying medical conditions. So you will see that there have been deaths in people under 60. Most of them have other underlying conditions. However, you've also seen death in healthcare workers, right? In other parts of the country, because they're dealing with people with they're actually now taking care of people who have the virus, not suspected.
Right.
With high levels,
Right.
They're doing procedures on them, they're intubating them, they're aerosolizing, so they're at risk. And obviously, the other reason why we talk about social distancing is that if somebody gets exposed, they send out letters, they say you might have been exposed, you need to be quarantined for 14 days, which is great. But then if that's a healthcare worker, and we have healthcare workers who cannot go to work, then we don't have people taking. And healthcare, it takes a team. And sometimes it's like, oh yeah, the doctor is there. Well, doctors, if anybody thinks doctors do things in isolation, then that's what it's a team, right? Everybody, from our techs, the transportation, environmental, nurses, social workers, medical assistants, everyone. So if we're quarantining, and that's why in most places now, even the doctor conferences, our regular conferences in the hospital that have 30 to 50 people, they've all switched them to WebEx. We're not at the 250. Some of them are 30, but again, if one person in that group is confirmed positive and you have to quarantine all 30 or 40 of them, that's damaging the workforce. So again, that's why it's important. And so I have 2 kids in college, and I tell them, that schools are canceled, kids are going to be home, they're all going to be crazy. It's not, at this point, it's not the 20-year-old college kid. You will do fine even if you get exposed. The 20-year-old on the plane with you, or who you're hanging out with, may live in a multi-generational family where they see grandma, they're going to see grandma next weekend. They feel a little cold cough, grandma gets sick and dies from it, right? The healthcare workers taking care of grandma exposed, everyone's exposed. So it's really important to think about this, about not just the personal, but also kind of the greater good. And that's why things like hand washing, social distancing, taking care of each other in terms of looking out for each other, calling out bad behavior when we see it, are really important. And really not hoarding resources.
So there's been a horrible, horrible rumor out there that Black people cannot get it. That is not true.
I heard that too.
I heard it.
I heard it a couple of times.
I heard it a couple of times. It's not true.
There are memes out there. There's threads
memes,
about why that is true.
Exactly. It's not true. We are just as susceptible as anyone else. And actually, in our communities, think about it. Grandma, she's usually the babysitter, or she lives with you, or, so therefore, it's probably worse in our community only because grandma is actually in line with the young people on a daily basis, and they could be carriers, and they could be just as fine as, walking around, everything's great, but then she's going to get sick, like she said, and go down quickly. So you want to make sure that you don't listen. Like I said, please make sure when you listen to people, make sure it's the proper resources. I've noticed on Facebook we found a lot of people who all of a sudden are ID doctors or doctors period, and it's like no. So you need to make sure when you listen and when you read, you're reading from a factual place. So yes, Black people can get it. So don't think that we can't. We can.
And I think one of the things that kind of made that kind of come up was because when they were looking at some of the initial data, people were like, oh, I don't see any Black people, not one Black person. But again, you got to think about the initial outbreak was in China. In a small part in Wuhan, then it expanded. And then
Italy.
Iran and Italy.
Iran
Those were
Italy.
the top 3 countries. And
although I used to visit Italy.
So it doesn't mean there are no Black people in China, Iran, or Italy, but that's not a predominantly Black area. Those are not predominantly Black areas. So now that it's starting to hit other parts of the world, including the United States, we'll start to see.
Well, like Pennsylvania apparently has been hit very hard.
Cases,
they're having some
And
travel bans over
correct.
there even. So obviously there's black
Washington
people in
is
Pennsylvania.
on quarantine, Washington State. So it's really important to not, and it's interesting because the first time I saw that, I thought it was, and then you look, you put in COVID-19, and people, their threads, and people are like, this is finally, this is great, this is working for us, and the danger of that is, if you think a message does not apply to you, you can see it and not even see it. You can. Exactly. There's so many times where you think. So people see this stuff coming out. There's also with hand washing. But if in your world you already believe that black women, that's for them. Or I'm going to do this stuff. We're going to have our things, and that's what's going to then be. By the time this has spread so much, and more than anything else, this country is pretty segregated. So what you're going to see is outbreaks that wipe out, or get people really sick in certain parts, and you wonder why. Even though the messaging is public to everybody. So I think it's really important to not, those kind of rumors. But the good thing about the social media is you hear about those things and we can address it and talk about it.
And prevention is worth an ounce of cure. So let's prevent and prevent and prevent. Let's wash our hands after everything. Just wash your hands, wash your hands. Now,
stay home if you're ill.
And please stay home if you're not well.
Please, 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 let's think about this as greater good. Not just the 20-year-old or the 30-year-old who's going to bounce back from it. It's who that person could be exposed to. What that means if somebody else who has a compromised immune system. Sometimes we use the age as a breakout, but there are lots of young people who have compromised immune systems because of other
for whatever
things.
reason.
And they're getting chemo or they have HIV, something else going on. We don't know. It's not written on them. They're living their best lives, which is great. But let's just assume that you're doing this to protect somebody else, and that until we get to a point, and one of the things we kind of talked about a little bit before we came on is that access to care in communities of color and being able to access care and get care readily is not always great, even before this COVID started. So when it says, call your doctor and all that stuff if you get sick, we need to be working on prevention, things we can do, because the system will get overwhelmed if a lot of people have the infection, and then if you can't get access to care, the hospitals cannot handle all of that. So we really need to really work on the prevention, simple things that we can do. Getting a flu shot, staying healthy, washing our hands, cleaning surfaces, talking to our kids about it. And the kids are watching. They're going to see how we handle this, and the anxiety that comes and the panic that's ensuing. They're going to be in history. How did we handle this when this was happening? And how, as a community, did we do that? And so things, the rumors, we need to talk about, bring it up, and make sure that there are people that are able to dispel these rumors.
You had another question?
Yes, there is a question that came from one of our fantastic users. What should people do with asthma if you have an asthma condition?
It's the same thing. Just wash your hands, sanitize, and honestly, if you're not feeling well, stay home, because you don't want to, get some respiratory droplets from someone else that does have it that you don't even know they're a carrier of it. So you just want to. You want to stay, you want to just stay as healthy as you possibly can. And I was also going to mention, there are people that are going to have to travel. It's just, that's just what they have to do. Either they have to take a train. Here in Chicago, we have a great train system. They have to take the train, or they have to take the bus. We have a great bus system. Or you do have to fly. But you can do things. You can, take your wipes, wipe down your area. If you're going to get on a plane, there's so few people on the plane now. You can probably all get a window seat. Window seats are the best. And I think that I like to sit in the window seat anyway.
Because I can.
And I can lay go to sleep. That's me too. But for this COVID-19, window seats are the best because you can avoid somebody coughing on you. You don't have to worry about somebody passing you 20 times to go to the bathroom. You can, it's really safer if you're going to fly to just get in the window seat. So
well, we can't all get.
Well, no, that's what I'm saying. On some flights now, you can get a window seat because so few people are flying, and the poor airline industry is taking quite a hit. But if you have to go somewhere, pick a window seat if you can, and make sure you wipe down your area. One of the biggest places of bacteria is the call button area and the light.
And the light stuff.
So, if you wipe that down, and you know what I did read, and I did this, I've been doing this for years, and I flew 23,000 plus miles last year on one airline alone, and so I know that it works. You should turn the little fan high. Who knew? because they said it circulates the air, and so that helps to prevent people, because a lot of people actually get colds on planes. Period.
People
Just
be like,
every time they travel, they
for
get
work,
sick.
I have a sore throat and things like
But
that.
I turn that fan and I make sure it's on full blown, and that's the only thing I touch up there. I turn that. I don't bother the light. I go to sleep.
Yeah, so
but definitely do those things.
Those things are like you can't control them.
Right.
Those magazines and the thing, oh Lord, those.
Yeah, I'm sure it's a cesspool of bacteria.
This is before COVID. This is just things that then the
and
tray
just even the tray
tables
table,
and
all of
they're
that.
just,
So just
so just
wipe
do
it
that.
down if you have, because I know it's very hard to find wipes right now. But if you can find them, take them with you and wipe everything down. I know some airlines are checking temperatures before you get on the plane and when you get off the plane, because they want to make sure no one has a fever, because if you do, you may possibly have it.
Yes. And they have masks now, so if somebody has a cough, unfortunately people have allergies and stuff, it starts to sneeze, they'll mask you, because now at this point they're trying to prevent anybody from spreading the droplets.
And we understand it is allergy season, the seasons are changing. But this is why people are looking at you when you cough or sneeze, because they're scared.
I got on an elevator about 2 days ago, and it was full. We all got on, and the lady in the back was like, nobody cough. I mean, and nobody even laughed about it, because everybody was just like, okay, we'll just stay on. But for a viewer or the person who called in with asthma, the goal is, stay home. But if you feel like something's different from your baseline, so there's nothing that you need to just do or go in because you have asthma. But if you're feeling shortness of breath, you can't tell if this is an asthma attack and all that, what you would do is call your doctor like you would, and they would have you come in, because obviously if you have underlying lung disease, and you get a viral infection, any viral infection, which is why people with asthma should get their pneumonia shots and their flu shots every year. And it's interesting, I have asthma patients who still won't get their flu shot and still smoking, so it's important to do all the things you can do to prevent your lungs, because if you do get this infection and it goes down and causes a pneumonia, if you already have any kind of lung problems and not able to clear secretions, yes, you might be an outcome, but it doesn't mean that everybody with asthma now should be doing anything different. You should have had your flu shot, and they're still giving it because we still have flu. We still have cases of flu right now. Just do exactly what you're doing. Call your doctor if something's different. They'll see if talking to you on the phone is this. They'll triage you. If you have no fever, nothing else going on, have you missed your inhalers, do you need a prednisone, they'll do all that. But if they do think you need to come in and get tested, they'll figure out how to do that. But going in with asthma, just going to sit in an emergency room just because of to check for COVID, you might actually leave with something you didn't.
And that's what I say. We are saying call the doctor, and it's not just for the doctor and for the people. It's for you.
It's for you.
Because if you are sick and you go sit and you don't tell the doctor you're coming, by the time you're seen, you've been exposed to God only knows what else. So you want to call ahead and say, hi, this is how I'm feeling, and then let them make a choice and a decision about where you should go, or when and everything.
Where and when, yes.
Yeah.
It's wonderful information. Thank you, doctors. There's another question. Are there any supplements that you can take to boost your immune system?
I mean, you can try taking, vitamin C supplements, emergency and stuff like that. What else do people take to boost their immune systems?
Daily vitamin. I mean, whatever. I mean, the main thing is staying healthy, because right now, if you don't have it already, that's good.
Right.
And most people don't, because we still have less than 2,000 cases in the whole of the U.S. So most people listening to us from the U.S. have not. I don't know anybody who has it. It's staying healthy. What you would do to stay healthy, drinking lots of water. If you're exercising, do that. Some people have cautions about gyms. In parts of, other countries trying to shut down gyms are places where people are sharing stuff. So there's a lot of wipes and stuff.
Wipe down your equipment.
Everything. Some gyms will close. Some people have closed down their gym membership, but then to figure out other ways, work out in your house, go for a run, be outside if you can. So you want to stay healthy with your immune system, eating right and things like that. There are no specific supplements, just like in the flu season or anything else. It's just regular vitamins if you can, and eating healthy and just
if you eat a well-balanced meal, you really don't need supplements.
Correct.
But of course, there's always some place that we may be lacking, and if that's where you're lacking, then you need to take that vitamin to supplement, which one daily vitamin usually handles that.
Yeah, another amazing question here. Is there a chance that the virus can turn into something else? For example, a different strain?
Yeah, it is possible, and they're monitoring the good thing about this is now that, especially now that it's been declared a pandemic, right? It's in 133 countries as of today. Yesterday was like 122. Then it's spreading pretty quickly. It's a pandemic. What that does is allows, first of all, we're all working together as the world. So it's not like, and that was why very quickly WHO called this COVID-19. Because the minute it's like a Wuhan, it's China, it's this, it seems so remote,
Exactly.
so distant, so
You had to change
and a
the
lot
name.
of, so they had to change the name, so it wasn't regional anymore. Initially it was
And
called
so
an
people would pay attention,
epidemic,
and you can only
an
imagine.
epidemic for so long, and eventually they declared it a pandemic. We're working together, we're sharing resources, data is happening, vaccine trials, everything's going to happen concerted, because we realize now, as I can't remember who said that quote, that a disease anywhere is a disease everywhere. And this is one virus that makes people think about that. Like, this is not a regional thing, this is not a them versus us thing. A disease
Everywhere.
anywhere is a disease everywhere. Doesn't respect socioeconomics. We've seen, our biggest
Oh yeah,
actors
Tom Hanks and Rita
NBA,
Wilson.
Prime Minister's
Yep.
wife and all that. So there is no, it's stuff that's shared. As long as we're humans and we interact with each other, there is no respect of status. And so it's important that now that it's a pandemic, that we know that we have concerted efforts to be able to address this as the world, like the best experts, doesn't matter where that is coming from. So this virus is being tracked. They sequence the genome very quickly. There's already vaccine studies that are going to be going into vaccine trials that may start very soon. Now, the vaccine, if there is a vaccine that's successful, that's safe and efficacious, NIH and Dr. Fauci are saying, maybe 12, 18 months. So, because vaccine trials, you have to make sure they're safe.
Right, of
They
course.
have to make sure
of
they're
course.
efficacious. It's
Yeah.
a whole process. But the fact that they know enough about the virus, that we can start to look at vaccine studies, there's already trials looking at certain drugs. There were companies that were looking at drugs for Ebola, right? And they saw, this virus has some similarities, let's try it for this. So there's already clinical trials going on certain drugs to see, for people with severe disease, if it can change the course. So while the virus, there can be genetic, and viruses that divide so quickly keep altering a little bit. That's why it's hard to have vaccines for certain infections, because the virus keeps changing, just as,
I mean, and just like we know with the
But the
flu
flu.
vac, there is several different strains of the flu, and so sometimes the vaccine we have hits the right
better
one,
match,
and
and
sometimes it doesn't.
and
But you should still always go get the flu
Yes,
shot.
and that's such an important thing, because the viruses, like the audience member said, can mutate and they can change, but sometimes the changes are very minor, so it's still a very minor mutation.
So you could have a minor course. So
Right.
just because you have the vaccine and maybe it wasn't that strain, you could literally cut down the time
Correct.
of being sick
Correct.
in half because you did have the vaccine versus someone not having the vaccine and who gets severely ill and can't get better. So, and so I personally said, and I'll admit, people, they know the flu vac is out there. Been out there for how long now?
Oh, Lord.
Yes, exactly. Too long. And there are so many people that do not get flu vacs. What did you say? 40%
Yeah,
of
it
people
wasn't
actually get the
40%
flu
of
vac.
the American
So even if
population
we get a
gets the flu
vaccine for this,
every year.
I'm nervous that people aren't going to get
I
it
know.
anyway.
Well, yeah.
So that's what I'm like, just especially, let's say the flu vaccine, if you are immunocompromised in any way.
Lord,
So
yeah.
if you're a pregnant woman, if you have any lung condition,
Diabetes, heart
disease, HIV,
HIV.
AIDS,
Yeah.
these are the top priority people and I'm sorry, and the population of over 60,
Mm-hmm.
those people need to go and make sure, senior citizens basically need to
Yes.
go and make sure they get a flu vac. Now, they also flu vac for children too, right?
All right. No,
Yeah, but I'm saying
everybody-
they also
yeah,
believe that kids
correct,
are
under 2,
so
because
under
they're high
2
risk, yeah.
are on that same profile. So these are the top people that need to make sure they have their flu vaccine.
And it's back
Because what you don't want to be is sick with the
Oh my
flu
gosh.
and then end up someplace with
Where you
somebody
get
that has
infected.
corona and then you get that, because the two together
Yes.
is a lethal combination.
Right.
So therefore, that's why we're saying it's so important
It
for
is.
you to make sure you're
Yes.
healthy, because if anything is already compromising your
And
immune
then
system and you
you
put
have no
something else on
immunity to
top of
this
it,
virus.
you'll
Yeah.
never
Yeah.
resolve, you just won't make it.
Right.
So, asthmatics that are out there running around and they don't have any kind of stability in their asthma and it's just totally uncontrolled,
Then they
this
go
is
to
not
the
a good
emergency
time.
room,
Right.
and then they get
they get something else. So
it's
this is
really
not a
good.
good time. You want to make sure that you are in your optimum health right
Correct.
now.
And the good thing is that this virus is being monitored, right? Because we know exactly when it started in December and all these cases. So we'll be able to figure out over the months, here we are at the end of March, how much difference and diversity in the virus. So that's a good question. Can it mutate? We'll know more because all
Right.
of these are being studied. This is our first time with this virus, but we'll be able to know at the end of this, whenever this starts to die down, how different the viruses towards the end are from the ones in December, and how over a couple of months, how much did it stay conserved and how much did it spread. But that's something we'll have. But
Right.
again, the flu shot is we're still getting flu cases.
And I'm
right
sure
now,
you've heard
too.
people talking about flattening the curve.
Yes.
There's a curve of how it's
Yes.
been going up, in more cases. We can flatten the curve if we all just do our part.
Our own
And
prevention,
so our
right.
own prevention will help to flatten the curve
Yes.
and just be smart. Just don't do anything crazy. Just be smart and it will flatten the curve.
Yes.
Excellent information. Thank you, doctors. It's actually been a few questions that I can just roll them into one.
That's fine.
What should people do with autoimmune diseases, but in particular, should they be wearing masks?
So, like we said, no, with the autoimmune diseases, if you are not well, please don't go out. Just stay at home. Because if you're going to be in a large group of people, then it's just not safe for you. And so that is the biggest thing, is just if you're not well, you need not go out. So that's what I say. Anybody with any immunocompromised condition that's not feeling well, you definitely need to stay home. What else would you say for autoimmune?
I would say, and even for people with autoimmune diseases or people who are not, even if you're not clinically, you actually want to avoid large gatherings and public places because you are somebody who doesn't have that reserve if you
Right.
get infected with someone. So when they talk about older people staying home and not traveling, it also applies to somebody who is severely immunocompromised, because you don't want to be out there because the little kid or the 20-year-old in the grocery store
Right.
who has a little bit of a sniffle, who's getting over it, could infect you. And then if you already have a compromised immune system and you're ill, you definitely want to call your doctor and say,
Mhm.
hey, this is what's going on, when do I need to come in? Because when we do those phone triages and figure out who needs to come in, we're looking at the profile of the person. We're asking
Right.
about symptoms,
Right.
fever, cough, shortness of breath, all of that. We're also looking at who that person is. Are you young and previously healthy? What are your medical conditions? So if you have somebody who's on steroids, who's on immunosuppressives, and they have fever, cough, you're going to be like, okay, stay home, mask as you're coming in, meet me, XYZ. We
Right.
need to test you, we need to check your oxygen status to see if you need to be in the hospital or
Right.
not. And so bottom line is, if you have a compromised immune system and you're in an area where there's a lot of disease activity, is stay home. And if you start to feel ill, stay home and call to figure out where you need help. Obviously, if you're high fevers and you can't breathe in the middle of the night, you need to go into the emergency. But the goal is to not just have everyone rush into
Right.
the ER, because the ERs are overwhelmed with people who are not that sick.
But can get you
Um,
sicker because of your
compromised
immune system.
immune
Yeah.
system.
So they also ask, should they wear a mask?
Just to protect themselves? Well, the thing is that there's no evidence that the masks protect you if you're walking around in the community, because the stuff can land on the mask. So
And
you're
it'll live
right,
there.
but it can, somebody, because what the mask does is we know this virus is spread by droplet, right? So respiratory droplet, you cough out, blah. So if someone's ill on the plane anywhere else, or you're going, let's say your doctor
They
says,
need a mask.
meet me at Northwestern, wherever, county. You need a mask because when you cough, you're coughing. You can't help yourself. You have an infection. It could be a cold, but you're coughing, so the mask protects that. So it's not landing on the doorknob for the next person in the car, right? That's what it's to protect
Right.
somebody. But for you who are
If-
walking around, even if you're wearing the mask, the same stuff that somebody around you, they cough it onto the mask. And then while you're figuring out how to make sure the mask is okay, then you touch your eyes, then you touch your nose, and then you do that stuff, you could actually make it worse for yourself to just wear a mask. Now, if you're living and caring for somebody in your home who's on quarantine or who has a virus, that's a whole different thing. But to just wear a mask because you're protecting, there's no evidence that works, because all that does is stop the stuff from going directly to your mouth with the mask, but then it just stays on the mask.
Mhm.
And then you touch the mask and touch everything else, or people wear it the next day, so they put it on
Exactly,
the thing,
yeah, and then they put it back
again,
on.
and then the whole process. So it's and we know the stuff, but you can understand how people just feel like they need to do something, and that's why we're getting the questions
That's why,
about
stay home then.
supplements and masks and stuff, because
Right.
people they feel like, if there was a pill for this, people would be
They
like,
would
give me
take
a
it.
pill for that, but there isn't. And so, but bottom line is, the social distancing, making
washing.
sure we're coughing and stuff, and if you are coughing, then you should be home.
Right.
Doesn't matter if it's your allergies, sorry. Because now people will
You're right,
like
you're
stone
right.
you.
No, you're right.
If you cough in public, people
Yes.
are like, what was that?
Right.
Like, oh, it's just a tickle.
No,
My
no,
food went down
right.
the wrong way.
Yeah.
Trust me. So
But yeah,
it's
cough,
social-
sneeze in your elbow.
Correct. And if you use a tissue, dispose of it, clean your hands, and assume that the person before you wasn't practicing good hygiene. So shared surfaces, people don't think about it in the workplace, the little kitchen area and the coffee area that we're all using and all of that, everyone's touching it. It's just wiping down surfaces in the hospital, the keyboards, somebody else just used it. Well, just switching
Yeah.
computers
Yeah.
is to wipe that out and just avoiding, touching your stuff before you eat and after washing your hands, which we shouldn't have to talk about,
But you
But-
still do.
yes, so.
Wonderful information, thanks. We have another question here. Can colloid silver slow the virus down before it reaches the lungs? That's a very technical question. Colloid
Colloid
silver.
silver.
You didn't hear about that?
No, I
silver
didn't.
stuff?
No.
I saw it somewhere. I think that's not true too.
Yeah, I would. Where would you put that?
No, they want to ingest it. They're supposed to do something with their lungs.
No, I would say I have no knowledge of that, and I haven't seen that on WHO or CDC or places that have taken care of people with this virus. And people have recovered. Most people, like we said, 88-90% have recovered from it. That's not something that I have seen or heard that works, so I would not endorse that in any way,
Right.
because I don't think so.
Yeah, you need to look it up when you go
Yes.
because that silver, it turns
Yeah.
people blue, and so they was look it up.
Okay, so I hadn't heard
Yeah.
of that.
Look it up.
But again, what happens? Why, if you go and see this, what can you do as a apart from hand washing, cover your cold, avoiding crowded places, all that is also looking at creditable, reputable places and source
Right.
of information. Because just like in any time, there's always going to be
There's fake news out there.
misinformation, there's fake news, and sometimes when people feel like people are going to make money off this stuff, people bought all the hand sanitizers and put it back on Amazon.
Right.
People are hoarding during this time of misfortune. It's crazy, and
Right.
It gets worse. It brings
Yeah,
out
the toilet tissue
when
thing I
things-
still will never
when things
understand.
get bad in anything, no matter what it is, it either brings out the good in people, and people are looking out for each other, and
Or
for the
the
older
opposite,
people who are
yeah.
shut in and saying we'll go and donating. Because some kids, one of the things we haven't talked about is, yeah, you can telework, you can telecommute, schools are closed. There are kids in this country where 2 of their 3 meals are at school.
Yep.
There are people who
And
depend
there's
on
college students who
Kinds-
their dorm room was their
was
home,
their home.
and they don't have another
Correct.
home to go to.
So
So you
that-
close the campus. Where are they going to go?
Where are they going to go? So that's the thing. It's like it brings out the good. People start to think, okay, what can we do? The kids who are home, how do we donate more to the food pantry? Because now kids are home. They all of things like that. How do we help out? How do we send information? How do we video conference or
And I know
FaceTime with people?
Comcast is now gonna,
Allow-
because there's some people that don't have internet.
Correct.
So you move the college classes online,
Zoom
but not everyone has
broadband,
online.
yes.
And so Comcast, I know, has stepped up and they are
Correct.
filling in the gap with
Correct.
internet
Things that you
service
don't
for
even
people.
think it shouldn't happen that in the U.S. There are
Right.
people with that, but it's the truth.
Because
But-
they have service, of course, on their
Correct.
phones, but
But
there's a
not
lot
to
of things
do
with school you
assignments.
cannot
Correct.
do on the
Correct.
phone. You have to be at an actual station, a
Correct.
computer.
So just like that brings out the good in individuals and people
Yeah.
looking out and saying, hey, this is what you need to do, this is good information I found, there's going to be what comes out. People are going to monetize this and figure out how to make money. They're going to say buy the supplements because it
Right.
works and do all that. So it's really being able to discern where you're getting your information from and going on the CDC website. And they actually put in things, what you can do as a community member. And if there's something that has been shown to work, it will make it up there.
Yeah.
There are enough cases all over the world, and we're months in the US behind, weeks and months behind other places. If there are things that have been proven to work, things that help,
They'll
we'll
tell
see it
you.
up there,
Mhm.
right? So I understand the need for people to want to what can we do?
Right.
But again, I hadn't heard about the
No, you'll have to look it
this-
up.
Wonderful. There is another question that's addressing the allergy piece of when it's concerned with the flu vaccine.
Mhm.
So the question is, how are seniors supposed to approach the situation where they're allergic to the actual flu shot?
So you need to talk to your doctor then, because actually there's all sorts of ways around it now, and They've had all sorts of different things. So talk to your doctor because there is a million different things to figure out that. But yeah.
Correct. And so a lot of people.
Because I'm one of those people.
Yeah. So like in terms of the egg, but there are
Yeah.
vaccines that are not egg based anymore. So
Yeah.
if you have an egg allergy and all that, because it's important for people in healthcare. Initially we saw people who said I had allergies. There are different ways to get around that, and so that's something you can talk to your physician about. And there are some, just like with penicillin allergies, there's a lot of people that got a flu shot one time and they felt a little achy after that, so they consider that an allergy. So
Which that's
talking
not what it
to
was.
it's not.
Yeah.
So it's just talking to your doctor or healthcare provider about that, and kind of doing that to make sure that we can still get vaccinated. Yes.
Well, thank you, everyone. If you have any other questions, we'll try because we can look in the comments. We'll try and look in the comments and fill in some answers for you. And I actually am going to do another Facebook Live with another physician. We did one last week. We're going to do another one to just update people as well about this. And we'll just, and blackdoctor.org is a great resource,
yes.
just like the CDC and the WHO, because they'll have information coming from both of those places. So if you want to come to blackdoctor.org's website, that will be a great place as well, that will have great factual information, which is most important. You want to make sure it's factual information.
Correct.
How can people find you online if they would like to talk to you further?
I am my Facebook page is Toyin Falusi. I'm on Facebook. That's just like my regular personal Facebook page. I'm a physician at Cook County Health, so our website is cookcountyyhs.org, and one of the physicians there, Dr. Falusi Adeyemi. And so that's kind of it. It's like Toyin Falusi. I'm tagged on this feed, and I work at Cook County Health. But again, messaging is really just don't panic, hand hygiene, staying home if you're ill, calling ahead if you need to go into, and looking out for older people and people with a compromised immune system. And that's the thing, is not just thinking about I'll get this and get over it, because you will.
Right.
8 and 9 times out of 10.
Right.
But that the person next to you may be taking care of somebody who
Yeah.
has a compromised immune system, and that we can learn from weeks
Right.
weeks from what happened in other countries, so that we can do this. And prevention is always better than cure. And what I'm hoping, and what we both hope, is at the end of this, when this pandemic recedes and we're back to our relatively normal, that we never go back to where we were, where we had to talk about hand hygiene.
Right.
And that everyone's doing
keeps it like
better,
that.
and we don't regress once it's done, and that our public health infrastructure stays well and well funded, and that we look out for each other the way we're going to have to in the next couple of months, and that more than 40% of the American population gets their flu shot next year.
Right.
The season is going to start. We're going to start vaccinating by September, October. That number, because of this, allows us to move that number.
And you
We're
still can go
fighting
get
that.
one now.
And you can
so
still.
just
The one for
letting you
this
know.
season,
Yeah.
we're still doing.
You're still gonna-
And that's really important.
Yeah.
And just really, staying credible with information. And yeah,
Well, thank you.
thank you.
I am Ask Dr. Renee on all platforms, but I wanted to let you know, my YouTube channel, I have all of the videos that I've done with blackdoctor.org. So if you need to learn about diabetes, you need to learn about anything, we've done everything.
Yeah.
I think you can go and see all those videos on my channel, Ask Dr. Renee. And thank you so much, and we will see you again soon. And like I said, if you have any questions still, and if you're watching the replay, feel free to please type them in the comments, and we will try to address them as we see them. So, and definitely visit the blackdoctor.org
Yes.
website.
Yes.
You can always contact them too if you need to send them a question. Send them a question, and they'll get a physician to get back to you. But
Yes.
definitely make sure we don't forget to just wash your hands. 20 seconds, wash your hands. ABCs. Bye.